Diabetes affects 23.6 million people in the United States, or 8% of the population. If you are one of the many Americans who suffer from diabetes, you are all too aware of the wide range of effects it has on the body, including your teeth and gums. That's why if you have diabetes, it's very important to work with a dentist who understands diabetes and can give you the kind of oral care you need to ensure you remain in the best health possible. For the next few minutes, this video will explore some of the oral challenges people with diabetes face, as well as the steps you can take to keep your mouth healthy. There are two basic kinds of diabetes. Type 1 diabetes, which typically occurs before the age of 20, results when the pancreas, the organ that secretes insulin, is attacked by autoantibodies. People with type 1 diabetes, who account for about 10 to 15% of all diabetics in the United States, need insulin in order to survive. Type 2 diabetes, the most common type of diabetes, is a condition in which the amount of insulin produced by the body is not sufficient. While insulin is sometimes required for type 2 diabetes, in many cases this type of diabetes can be managed through better lifestyle choices associated with diet and exercise. In both types of diabetes, the result is elevated blood sugar, and it's this high blood sugar that can take a serious toll on your teeth and gums. Diabetes can cause tooth decay and cavities. This happens when the bacteria in your mouth interact with the sugar and the starches that are in the food you eat and the drinks you consume. When bacteria meet these sugars and starches, a sticky film called plaque forms and adheres to your teeth. Plaque contains acid, which eats away at the enamel on your teeth, resulting in cavities. Plaque is never welcome, but the elevated blood sugar levels in people with diabetes cause even more plaque to form. In addition, people with diabetes have a more difficult time fighting bacteria. The result is more acid, more wear on your tooth enamel, and ultimately more decay. Additional decay may also be triggered as a result of a decrease in salivary flow, which is a common complaint for people with diabetes. In addition to an uncomfortably dry mouth, the lack of moisture in the mouth makes it more difficult to control plaque. As plaque continues to build up on your teeth, it can burrow under your gum line and turn into a substance called tartar or calculus. When plaque and tartar remain on your teeth without being removed, they irritate the part of your gum at the base of your teeth called the gingiva. Gingivitis, an early form of gum disease, results when this part of the mouth becomes swollen, tender, and bleeds easily. You may notice that your toothbrush is pink after brushing, or that it hurts to eat firm foods like apples. When gingivitis advances, it becomes periodontal disease. This is a more serious disease that affects both the tissue in your gums and the bone that supports your teeth. As the tissue and bone become more affected and diseased, your gums actually pull away from your teeth. Teeth become loose, and eventually they fall out. Once a person with diabetes has periodontal disease, gum health becomes very difficult to manage. People with diabetes heal more slowly than those without diabetes and have a harder time resisting infection. To make matters worse, the infection can cause an additional spike in your blood sugar, making your diabetes even worse. In addition to increased decay, gingivitis, and periodontal disease, there are other complaints that go hand in hand with diabetes. For example, if you need oral surgery or other dental procedures, your oral tissues may heal slowly or may seem not to heal at all. This is a result of impaired blood flow associated with diabetes. People with diabetes often complain of a burning mouth or tongue. This sensation is caused by a condition called thrush, which is a fungal infection in the mouth and on the tongue. This is most common in diabetics who are taking antibiotics. The fungus that causes thrush thrives on high sugar levels in saliva. Before you start thinking that diabetes means a lifetime of problems with your teeth and gums, here's some good news. The complications we've discussed in this video are totally preventable. Prevention is in your hands, as well as in the hands of a dentist who is knowledgeable and experienced treating people with diabetes. The trick is to manage your blood sugar levels while taking extra good care of your teeth. Begin by managing your blood sugar. If you have type 1 diabetes, this means checking your blood sugar frequently and administering insulin to ensure that levels are normal. If you have type 2 diabetes, this means following your doctor's orders when it comes to diet and exercise. In many situations, blood sugar can be effectively controlled by managing these two important lifestyle choices. Finally, if you are a smoker, quit. Diabetics who smoke are 20 times more likely than non-smokers to develop periodontal disease and thrush. Practice good oral hygiene at home. You'll have to spend a little bit more time on your teeth and gums, but it will be well worth it. Brush at least 3 times a day after every meal using a soft bristled brush. Floss every day, and ask your dentist to show you how to use a tongue scraper to keep bacteria at bay. Depending upon your situation, your dentist may also suggest certain rinses to use at home that reduce bacteria or prevent dry mouth. Your teeth and gums should be checked and cleaned by your dentist at least twice a year, though many dentists suggest that diabetics are seen every 3 or 4 months. Your dentist will be able to suggest a schedule that works best for your specific needs. The dentist who cares for your mouth must be willing to work closely with the doctor who manages your diabetes. Your doctor's name and phone number should be included on your file, just in case your dentist has any questions that need to be answered. In addition, your dentist should agree to talk to your doctor before he or she does any procedures beyond a simple cleaning and checking. Together, your doctor and dentist will decide how to manage your diet, insulin, and any necessary drugs both prior to and after the procedure. Your dentist will also want to know about the status of your diabetes at every visit. It's important to share your blood sugar levels and let your dentist know whether you have recently experienced low blood sugar or an insulin reaction. If you are taking medication, your dentist will make note of this to ensure that any medication he or she prescribes won't interfere. If your dentist is treating an infection or managing periodontal disease that requires antibiotics, he or she will let you know if your insulin levels need to be adjusted. When it comes to emergency procedures, your dentist will check your blood sugar levels before performing any procedures. In most cases, he or she will ensure that your levels are stable before performing the procedure. As you can see, diabetics are at an increased risk for issues related to their teeth and gums, and extra quality care is of paramount importance, not only to ensure a healthy mouth, but to ensure health in general. It's imperative that the dentist you partner with has experience and knowledge of diabetes and diabetic patients. At our office, we know the effect that diabetes has on oral health. We understand the disease, and we ensure our patients get the preventative dental care they need to have healthy teeth and gums. Diabetes doesn't need to have a negative effect on your dental health. Simply fill out the form below for your complimentary diabetic dental health consultation in our office. During your consultation, we'll discuss your diabetes, come up with a unique dental plan custom tailored to your specific situation, and cover how our office can help ensure you have a healthy smile for years to come. So take a couple of seconds right now to fill out the form below to request your complimentary consultation. There's no obligation or cost, and you won't be pestered by any telemarketers or salespeople. This is simply our way of helping you to see how our office can meet all of your needed diabetic dental care. So go ahead, fill out the form below to request your complimentary consultation now.